Okay, I think that gives us enough time, and I'm sure others will continue to join us. But good evening. Let's get started. Thank you all for being here with me. I'm grateful to have you join us, and I'm especially thankful to the team at Propel for this opportunity and for their continued commitment to your success. Tonight, we're going to have fun, and we're really going to get things done. We have a lot of attendees this evening, which is great, but I do intend this to be interactive with the opportunity for you to be able to ask questions. We will have a Q&A at the end of the presentation, so please type your questions into the question box, not the chat box, and we'll get to as many of those as possible. But really, this is about you tonight. My name is Michelle Shimmin, and I am not an employee of Propel, so tonight I'm going to be coming to you as a third party that works in hundreds of orthodontic practices, and I'm thrilled to be able to educate and influence those that are participating in this evening's webinar, so that you also have the tools to be able to interact with your patients and educate them regarding a modality that supports and serves your patients' ever-changing and demanding needs. The processes that I'll be working through with you this evening are around how to effectively educate and influence your patients towards a treatment modality that provides tremendous value to your patients and provides tremendous value to your practice. I'm going to give you the tools to get your patients to yes today, minimizing the barriers to patients starting treatment through a true understanding of their value points and the benefits of accelerated orthodontics. My name is Michelle Shimmin. I'm the owner of Shimmin Consulting, and I have been in the field of orthodontics for nearly 31 years now. Seattle is where I call home, and I have the privilege of training and coaching practices and teams all over the world. I'm a wife of 24 years, and I am a mom to two pretty amazing young men who are almost 22 and 20. My background is in psychology, and I have held every position within the practice except those of doctor. Whether I'm training on psychological sales or influential communication in the exam process, or training leadership and management skills with interoffice communication, the foundation of my training is based on the psychology of changing and influencing behavior and decisions. As a business analyst, I know what it takes from top to bottom within a practice to get the greatest long-lasting results. And tonight, I'll be sharing many pearls for you to take into your practice tomorrow. So as I mentioned in the beginning, please take notes and write down the areas that you feel you have room for improvement, or that you will make a change or an adjustment and implement into your processes within your practice. Throughout tonight's session, we'll be working through the patient's path through your practice and every opportunity that we have to affect our patient's perception of their experience in your office. So these are tangibles you will take away and have the ability to implement tomorrow. After each topic listed, I'll be stopping for a few questions that I'd like you to think about and compare with your current systems and processes. And remember, we'll have a Q&A at the end, so I encourage you to really type your questions into that questions box. We'll be starting with the benefits of high frequency vibration review. Then we're going to move through the process and the path that your patient takes throughout your practice, where we have every opportunity to affect our patients' decisions and choices and their perceptions about how they think and feel about your practice and the modalities you have available through the new patient phone call, which is the very first point of contact. This is really where your education starts, laying the foundation for a same-day start. We're going to talk about the power of our words and how we can actually position Propel throughout our exam, and then how we can, the treatment coordinators on tonight's session, can effectively help to guide our doctors and support our doctors prior to even going into that exam room. We'll talk about the presumptive close and the financial investment presentation, the words that we use that can be really powerful in serving our patients. And then we'll provide some great information about an effective pending and follow-up process. I have also added a few slides that will discuss some great marketing ideas to really set your practice apart as well. Before we begin, I wanted to personally invite you to join my Facebook group, Ortho Masterminds. I'm a firm believer in collaboration and commitment, and this is really where you can ask questions and provide others with your own thoughts, recommendations, and expertise. It's a great resource that I provide a lot of content on as well. So if you're not already a member, please join today. Let's take a minute to talk about what Propel is. I find that if we as team members do not have the buy-in to what we're providing our patients, we are not successful at influencing their thoughts and decisions toward what adding high frequency vibration to their treatment provides them, or what the benefits are to the patients. Propel helps patients to finish treatment quicker while providing the greatest same result that you've always provided your patients. Propel allows us to see better tracking with our aligners and reduce or eliminate the discomfort, which helps with higher level of compliance with our patients and helps to avoid that burnout. It also helps to create additional value for when your patients are looking to choose you and your recommended treatment modalities. This part of it, when I talk about the buy-in for our team members, is really important and really valuable. Your team members should actually be excited and enthusiastic about what this provides our patients. That is the messaging that they will exude to your patients. What are you using to differentiate your practice? What experience sets you apart? And why would patients choose you? First of all, the previous slide, I mentioned the buy-in. When your entire team is on board and enthusiastic and excited about having a treatment option that your patients love, we're all happier. Who wouldn't want faster, more comfortable treatment? Who wouldn't want their aligners to feel better on the days that they switch, or with their brackets on their adjustment days? How really great for us as team members to be able to educate our patients on this benefit and of having the opportunity of being in the office for fewer visits and helping to turn our patients really into our walking, talking referrals. Ideally, that's what our intent should be, on top of providing a fantastic patient experience and orthodontic result. I'll share with you both my sons had Invisalign treatment and high frequency vibration therapy, and I have a personal experience that I can reference with as well, that I'll talk with later on throughout the presentation. But think about this. First, with high frequency vibration, it's really the first and only device proven to accelerate orthodontic tooth movement and increase predictability in simply 5 minutes a day. I referenced that both of my sons used high frequency vibration with their aligners, and I remember at the time really sitting back to see how it worked, what the benefits would be. I wanted to know and understand personally. So I paid very close attention to their compliance with it and really what I was hearing from them and how well their aligners tracked. And I remember we had gone on vacation, and it was probably eight months into their treatment, and I had actually forgotten to pack the device, and they had switched their aligners while on vacation. And I remember thinking that I was hearing a lot of complaining about discomfort. And it dawned on me that I hadn't heard that in the first 8 months of their treatment, and that they had been very consistent with their high frequency vibration device. And that resonated with me, because studies show through increased blood flow that it can really can minimize the discomfort that your patients experience and feel on their adjustment days or on the days that they change their aligners. Time and convenience is of extreme value to our patients. And now, especially after the COVID year that we've all experienced, our patients are really seeking out treatment that can minimize the number of times that they have to really come into your office. And this helps to also open up their schedules as we start to get back to a more normal schedule, or as students start to get back to school. Hopefully we start to get back to a more normal sports and activities that we had before, which is, again, extremely valuable to our patient schedule. Any service that we can provide our patients to speed up their treatment and make their treatment more comfortable will really be seen as an exceptional experience through your patient's eyes. The benefits to the practice of high frequency vibration is a streamlined workflow, more predictable tooth movement to expect our patients to complete treatment within their estimated months of treatment. You also have that decreased treatment time with fewer refinements for aligner treatment. The benefits to your patients we've just referenced is more efficient treatment, less disruption to their schedule, better hygiene. Studies show we have higher levels of compliance and that shorter treatment time. So that's reflective of less time in the chair and less discomfort to your patients. Who wouldn't want shorter, more comfortable orthodontic treatment? So talking about services that we provide to support your patient's treatment success, the Fast Track Patient app offers this tray change reminders, aligner wear tracking, and progress photos along the way. This really is a tremendous and remarkable service that you get to provide your patients, which increases patient compliance. This is what when patients can participate and come alongside us in the process of their treatment, their compliance increases. When their compliance increases, it supports shorter treatment time as well. When you see value into providing this service to your patients, your practice will depend on your ability for full practice integration. It's important that we have success in that. Help your entire team understand the why, so each team member can act as an educator and an influencer. The success does not start and stop with the treatment coordinator. Your front desk team should be able to jump right in to what Propel is when your patients see an educational brochure or your device sample at the front desk. I never want to hear the front desk team say, Michelle, our treatment coordinator will go over all of that with you in your exam. Think about the impact the front desk team has when they launch right into what Propel is, what it does for our patients, and how much our patients love it when asked. And then our treatment coordinator continues with that educational message as they move the patient into the exam. This is synergistic communication throughout every role within your practice. It's imperative you get your full team's buy-in that we referenced a moment ago for the success of the ability to truly influence your patient's decisions. We really are in a sales role and sales position, especially treatment coordinators that are in attendance tonight. I don't like the word sales. I like the word influence. The word sales is reflective of high pressure. And when I use the word influence, I feel that's more reflective of passion. I often say that it's not high pressure sales when passion is involved, when we're simply providing a service or delivering a message to our patients about what we offer to them and what options they have. To fully maximize the benefits to your patients and your practice's profitability, you need to adjust your appointment protocols and your scheduling protocols. So let's start with the very first point of contact the patient has with your office and the importance of laying that foundation right now through your new patient phone call. This is really where you want to position Propel right now. Start demonstrating what's in it for them through a message that tells this patient that you value their time. This goes hand in hand with supporting your same-day starts as well. We do not want the patient to hear about the treatment modalities you specialize in for the first time at their new patient exam. You should generate an excitement and an enthusiasm from this very first point of contact on this new patient phone call. The next slide will actually provide you an example of what this looks like, but you should always prepare the patient what to expect. This is controlling their perception. How long will it be? What will you be accomplishing at this appointment? You need to build value to the doctor's treatment recommendations, and the next slide gives you that example. Demonstrate that we understand and value this family's time. Generate that excitement and enthusiasm before the patient walks into your office, and drive activity to your website. Sally, our treatment coordinator, will be taking complimentary digital x-rays, photos, and a digital scan. Dr. Orthodontics will do an extensive clinical evaluation, Our goal today is to provide you with as much information up front as we can, and if Dr. Orthodontist recommends any treatment for Tyler at this time, we will combine as many appointments as possible so that you miss as little work in school as possible. We want to save you additional trips into the office. When we talk about emailing the patient, the new patient health history information, we want them to fill that out ahead of time and bring it into their appointment. We want to mention your website. You can also visit our website and gain valuable information about different treatment options available, including clear aligners and accelerated treatment options that provide shorter treatment times for you. This really does not have to be lengthy or sound like a robot. This is where your passion should come through. If you truly see the benefit for the patient, your enthusiastic message is what your patient will hear. This is where you also control the patient's perception about your same-day start. Remove the old script that says, and if you want to get started that day, we can take your records. This can actually erect protective barriers from the patient when they feel that we are simply trying to sell to them. They don't even know if they need treatment at this time. They haven't been into the doctor. This is not what my example script here delivers. It's preparing the patient for what they can expect from your office. It's building value to the doctor's treatment recommendations, demonstrating that you value their busy family's time, and it generates that excitement and that enthusiasm for them to want to learn more about accelerated treatment options you have available in your office. Take a moment to think about your practice and your current processes around your new patient phone call. Do you have a new patient phone script that your team actually uses? Do you adjust your new patient phone script to grow with your practice's treatment modalities? And then do you run mystery calls to ensure the effectiveness of your new patient phone call? I find in most practices that I visit or train that they've at any given time had a new patient phone script. However, so much of the time it really ends up going by the wayside. Team members feel they're good enough, or they don't need to say the scripting, or they feel that it's not natural and they don't want to sound like a robot. What I want to do is share actually an analogy. I'm on airplanes often. It's been less this year with COVID, but typically every 3 days I'm on an airplane. And you cannot get on an airplane without having a script read to you or delivered to you. Sometimes the attendants are hiding behind the wall and reading the script, and sometimes the attendants are dancing the script up and down the aisles. When you memorize a script, you actually can bring your own personality to delivering that same message. There's a reason behind the message that should be delivered. And treatment coordinators, an effective new patient phone script lays the foundation for your success with same-day starts. So I highly encourage you to work with your team to customize and create a new patient phone script that reflects your practice and the treatment modalities you have available to your patients, and then to memorize that phone script. Because again, once it's memorized, it's really easy to bring your own personality in delivering that message, yet you're still delivering the message. It's important when you get on an airplane that a message is delivered for the safety and the comfort of all passengers on board. And we have purpose behind our scripts as well. Again, if anyone has any questions or comments, please type them into the question box. I also will have my contact information at the end. You can reach out to me directly. So as we move through the patient's flow within your practice, let's talk about your new patient exam and the remarkable ability that you, as the treatment coordinator, has on education and influence for your patients to choose you and your recommended treatment modality. This is where you start to build a relationship with the patient, learn what's important to them, and start your education on Propel in your practice. Have your sample device out right now, even before the doctor has recommended treatment or the patient has chosen a treatment modality, because this is where you also have the ability to generate an additional new patient exam out of a parent. I always depend and understand that doctors are going to recommend the best treatment for this patient to get the greatest result in the shortest amount of time. That doesn't stop me in the beginning of my exams from educating on what we specialize in and what we provide to our patients, because A parent might be in that exam that really has thought about potential treatment for themselves, and it can actually generate an additional exam out of a parent or out of another sibling or even a friend if that parent delivers the message or passes that information on to any one of their friends. So don't miss out on that opportunity to be able to generate that additional new patient exam. This is also the time, TCs, that you read, recognize, and adapt your case presentations based on what you're observing in the patient. Ensure you are mirroring the patient's body language, tone, and their pace of talk. You will actually create an unconscious connection through this ability and have a greater level of success to affect and influence their decisions and how they think and feel about your practice and what you provide. In addition, recognize that different patients need different pieces of information. You can understand this through the questions that they are asking and how they are reacting to your communication. I'm very relational, and my husband is actually very analytical. If my husband were to bring our sons into your office for a new patient exam, the information he would need and the way he would need it delivered would be very different than if I were to bring our sons into your office for an exam. I'm all about the relationship, my experience with you, and if I feel that I can trust you and the doctor. My husband would need the science behind doctors' treatment recommendations and his concerns if treatment is not pursued. So it's important that you challenge yourself in this ability to be able to adapt your case presentations and your interactions, and you will have a better ability to influence a broader range of individuals and actually start more patients. This is also where you will start to understand what information the patient needs around Propel in conjunction with their treatment. It's important that you speak from experience. If they're utilizing staff members in your practice that have used the device that can share their story, or use patient testimonials or referrals. It's important that you have the preparation and the practice of scripting around Propel and how it works, why you use it, and the importance of how it really provides less discomfort, fewer refinements, and better retention for the patients. So there are some questions coming through about how we can get our patients to sign up for treatment without having to go home and talk to a parent or a spouse, I assume. And I will be going over all of that when we talk about our pending and our follow-up process. So those answers will get, or those questions will get answered. We do talk about also in the financial investment presentation how we can have an inclusive treatment fee, but it's really important that you minimize the barrier of a patient choosing an accelerated option, because we've seen the benefits of what it provides our patients. We know the benefits that it has to our practice as well. So I highly recommend inclusive treatment pricing, and I've got some examples, we'll go over that. We've talked also about the systematic tracking. All cases can change their aligners the same number of days in your practice with the protocol. So this is important, TCs, that you're able to deliver this message to your patients and you understand the how with this process. This is some examples of scripting that you might want to include in your process. And again, if you memorize the scripting, the messaging gets really comfortable that you're actually able to deliver the same message to your patient with your own personality. So scripting for braces you might include would be, along with your braces, you'll be using an appliance called VPro. It's a vibrating tool that helps the overall treatment of your orthodontics with its vibration technology. It helps to stimulate the cells in your mouth to help the movement of your teeth in a healthy, more efficient manner. The vibration also causes a soothing sensation you can talk about through the increased blood flow. We like to refer to it as a mouth massage, and our patients really enjoy it. This is especially helpful on adjustment days when your teeth may feel a little tender. You'll simply gently bite into VPro for just 5 minutes a day. We have patients that do it when they're in the car or during their morning or evening routines. With my kids, I had them do it while they were playing on the Xbox. It triggered for me a really convenient time to be able to accomplish it. If parents question this, it would be, our doctors want to make sure you receive the best possible treatment experience, the greatest result in the shortest amount of time, and VPro Appliance helps us deliver on that goal. Scripting for aligners might include a very similar messaging. And it might say this is especially helpful on tray change days when your teeth may feel a little tender. With your aligners in, gently bite on the V Pro for 5 minutes a day. Most of our patients do this either in the car or right before bed, when you will actually be wearing your aligners for a long period of time. This will help the aligners fit snugly and allow your teeth to track much better, getting much faster movement for your treatment. Your doctor or the doctor will require using V Pro when doing your Invisalign treatment. It's all in how we deliver the message to our patients. Are we excited and enthusiastic? Is that the message that we are exuding, and is that the message that our patients are receiving? After using this time to help your patients understand what treatment modalities you specialize in and the benefits to the patient, it's now time for the doctor to come into the exam for the extensive clinical evaluation and treatment recommendation. And you TCs should help to prepare and guide the doctor before starting this part of the exam. It's important when briefing the doctor that you do not bring your own assumptions to the table. You communicate with your doctor about this patient and what their value points are. This should actually be practiced and role played. It's important, doctors, that you don't come into the exam and ask the same questions that your TCs have just asked. If the TC comes in and says, Zach is on an all-star baseball team and the family travels every weekend for tournaments, it's a much more effective relationship communication when you walk in and you say, hey, Zach, I hear you're an all-star baseball player. Tell me more about that. As opposed to docs, you coming into the exam and asking the same question. What do you like to do on your free time? When your treatment coordinator has already asked that question. So create that synergy in your coordinated dance between treatment coordinator and doctor. And that's where you're really powerful in this partnership in starting more patients. It's really important that you summarize the patient's interests and hobbies and how Propel actually will fit into enhance your patient's experience. That's the friendly reminder at the end of the brief that I like to put on the doctor's radar as the doctor heads into that exam in preparation for those treatment recommendations. As we continue through the exam process, we need to realize that the patient has come to you for a reason. They have researched and sought you out. Be the greatest solution to their orthodontic problem through effectively understanding their needs and value points and meeting those needs in the best possible way. The presumptive close is actually moving right into serving this patient. Doctor needs to always pass the baton at the end of the exam by saying, Lisa will go ahead and get the next appointment scheduled for you. It was such a pleasure to meet you, and we look forward to serving you and having you part of our family. Again, have it be a comfortable message that feels natural to you, but deliver some form of message and thank the patient for coming to us and expect this slide. Expect that they are already a part of your family because you firmly believe that you are the greatest solution to their orthodontic problem. Summarize, doctors or treatment coordinators, after the doctor has passed the baton and exited the exam, it's imperative that you summarize the treatment again in what doctor recommended. Doctor is recommending aligner treatment for 18 months and will include our V Pro to maximize the efficiency of your treatment. You want to discuss the next steps. We already have your digital scan. The next steps are for us to create a fully customized digital treatment plan for you, manufacture your aligners, and then schedule you, and we can start moving your teeth on Thursday, April 15th. I have a 10 o'clock or I have a 2 o'clock. Which works best for you? That's an example of what we call our presumptive close. Do not ask the patient if they want to schedule their start appointment. Simply proceed into scheduling the needed next appointments to facilitate the doctor's recommended treatment. Believe in your doctor and your practice as the greatest solution to the patient's orthodontic needs. Believe in the patient-centered experience you provide and serve the patient in the gold standard customer service. It's not high pressure sales when passion is involved. Find the passion in what you provide your patients, and if the results for your patients will be imperative and exceptional through their experience. This is what will resonate with your patients as you proceed into scheduling their next appointments to get started in your office today. Influence the patient to not only choose you, but to choose your recommended treatment modalities. Oftentimes, it's very common for treatment coordinators to do the presentation and the treatment recommendations, and then to sit back and expect that the patient is not going to start with us or has to go back home and talk to a spouse. When we just proceed through that presumptive close, and most importantly, ensure that we've provided all of the information this patient needs or this family needs to make the best decision for them. If we don't ensure that we've provided all of that information the way they need it delivered, then they're still going to have additional information and need to go to second opinions or go home and talk to a spouse. So as we go through the financial investment presentation, I will give you some great tools and pearls that you can help simplify that process and avoid those barriers to the patient starting treatment today. I highly recommend that you bundle the investment of the accelerated treatment. You do not want to introduce barriers to the patient choosing the benefit of this modality. Remember, we're not promising a shorter time to the patient. This is a compliance device. However, you should feel very comfortable stating that studies show treatment time can be much shorter when using high frequency vibration. Another area that is generally ineffective or just plain uncomfortable is when it's time for our financial investment presentation and we simply print out a fee quote and hand it to the patient. This process should be interactive, finding the patient's true barrier to starting treatment. Is it the treatment that was recommended? Is it the timing? Is it the cost, the down payment, the overall expense, the monthly payment? Or is it their experience in our office? In addition, everybody wants to be a part of a group. So when we're talking about the financial investment presentation, the verbiage and the words that you use are powerful and what will allow you to be successful or not. Messages that are really important that you should deliver is doctor doesn't want finances to hinder a patient having an ideal smile. Therefore, we've created options to fit into every budget. The patient's like, they have options to fit into my budget. Again, everybody wants to be a part of a group. The Ritz-Carlton actually did a study on when they put information or statistics in a hotel room or a sign that says, if you want to contribute to a greener environment, hang up your towel. And they actually took that a step further and started posting the percentage of guests in that room that hung up their towel. So they started saying 57% of guests that stay in this room hang up their towel to contribute to a greener environment. And they noticed that those percentages increased significantly because, again, we all want to be a part of a group. So when we are talking about how we're going to present the financial investment to the patient, it's important that we break down the options that we have available to our patients. Of course, we talk about our pay in full courtesy if they wanted to take care of their portion up front. I have witnessed treatment coordinators say, I know this isn't a lot, but you can save $127 if you wanted to take care of your portion up front. Think about the difference of the messaging, because that treatment coordinator just told that patient how to think and feel about that pay in full courtesy. Think about the messaging when we say, and you can save a significant additional amount if you pay your portion up front with $127 savings. Or you can, as a courtesy to you with 0% in-house financing, we could spread your payments out over monthly payments. Most of our patients put about, and I'll demonstrate an amount down. And again, this is interactive. I'm not printing this. This is why the sliding scales are so effective. But if you don't have that option or ability, you can create an Excel spreadsheet that has automatic formulas in there. But just something that you can demonstrate where the patient can actually see and experience what happens when they put a certain down payment and what it does to the monthly payment. So I say, Sometimes the monthly payment is more important to our patients, and sometimes the down payment is more important to our patients. So if you wanted to put a little bit more down, and I demonstrate a higher amount, I always start first by going higher. This is what your monthly payments would be. And I wait a moment and I observe what the patient's reaction is. If they're waiting for more information, I'm going to continue. If they say that looks great, I'm going to stop right there, and those are the arrangements I'll make, and I'll print them out their fee quote, or I'll print the contract if we're scheduling their appointment. Or I say, if you wanted to put a little bit less down, this is what your monthly payments would be. Which works best for you? And this is where I'm getting the true commitment from the patient and truly understanding the needs for their financial arrangements. Remember, it's really important not to bring your own assumptions to the table and what you think the patient can or cannot afford. Should there be multiple pricing structures, multiple treatment options? We have to keep in mind that this really introduces barriers to the patient making a decision today when you do that. How can you drive this through really understanding the patient's value point and meeting this family's needs by really understanding their story? So sometimes we might put together packages, and that can be really effective. Maybe the silver, gold, or platinum level to choose from. Maybe a level might include Propel, and then bleaching might be included in a level, or Vivera retainers or gum contouring. This type of pricing structure can be enticing to your patients and allows you to have options for this inclusive pricing. But when you simply offer the option to add Propel, you're really introducing a barrier to the patient starting treatment today and making their decision. Because when we have that add-on, that's an add-on cost and expense to the patient, and that's not as effective as when we include it into our price. For less than a cup of coffee a day, you can speed your treatment time up and you can have a much more comfortable treatment time. You should have a very clear understanding of these patients' value points and what their needs are based on their story in your relationship building in the exam, and then recommend the best treatment for this patient and why. Assist your patients in seeing that they are unique, their orthodontic needs are unique, and your orthodontic solutions will be unique and recommended specifically for them. Think about this. Are you able to brief your doctor, and does it work? Do you see value in the importance of it? Do you simply brief your doctor because we know that's what we need to do, but it's not effective? Does your doctor set you up for success and effectively pass the baton? I know we have multiple treatment coordinators, team members, and doctors on tonight. And then think about your financial options and your financial arrangements for your patients. Is your down payment options the same with all treatment modalities, or are we introducing barriers? It's really important for when you talk about the doctor setting you up and effectively passing the baton, to be able to say, Michelle, will go ahead and get your next appointment scheduled. Do you have any clinical questions for me at this time? When we're talking about introducing barriers, it's important that we don't do that. We want to have the same down payment requirements for your patients to choose your modalities, or you're introducing the barriers for them to choose those specific modalities that are extremely beneficial to your practice and to your patients for the many reasons we've already discussed. It is also, when we talk about delivering a message to our patients, to really help our patients understand that doctor doesn't want finances to hinder a patient having an ideal smile or having the best treatment options. This is what we will continue to use to set our practice apart, is that messaging to your patients. We don't want finances to hinder a patient having an ideal smile, and we don't want finances to hinder a patient having the best treatment options that not only fits into but enhances their lifestyle. So I do want to talk about our pending and our follow-up process. And we have talked about what barriers we can come up against in patients starting treatment. And I actually am here to tell you that you address the barriers by actually minimizing those barriers in the very beginning process of your exam, in the very beginning, first point of contact with your patients, and in really being able to understand the needs of our patients. But when a patient doesn't start treatment in your office today, it's important that you have an effective pending follow-up process that actually serves the patients. Let's dive into how we can work a pending protocol for when you have not started your patients the same day as their exam, and maybe they're doing some more research or thinking about it or talking to a spouse. When this happens, first off, you need to ask yourself, what information did you not provide this patient for them to effectively make their decision? What information are they still needing? They have chosen you to come in for an exam for a reason. They have an orthodontic problem, and we should provide them the greatest solution to that orthodontic problem in the most educational and efficient manner. It's really important you set custom alerts in your pending process as well, and that you use verbiage and scripting that really works. And I'm going to provide you some examples for this. I know this is a lot of information. Feel free to snap a screenshot of this slide or email me if you'd like. Here are a few possible patient responses and how you might reply. Hello, Mrs. Green. This is Michelle at Dr. Orthodontist's office. How are you? I just wanted to give you a call to ask if you had any additional questions or concerns about the recommended treatment for Tyler, and if I could assist you in scheduling Tyler's next appointments. Mom might say, you know, I still need to talk to my husband about it, but no, I don't have any questions at this time. Okay, was Dr. Orthodontist able to cover all of the information regarding his recommended treatment, or do you think your husband will have any additional questions? I can email a treatment video and the digital photos outlining doctor's concern if that would be helpful. Okay, great. I'll check back in with you next week to see how I can make this process as easy as possible for you. Or another answer to the initial question might be, thank you, but we still haven't decided about treatment yet. Okay, great. Thank you for letting me know. Did you have any questions or need additional information I can provide you with to aid in your decision? Also, please know that it's important to Dr. Orthodontist that finances don't hinder a patient from having that ideal smile. So we have many options for financing to fit into your needs. Please don't hesitate to let me know. It's all in how we are looking to serve our patient. And it's really important that we provide effective scripting that eliminates the need for unnecessary follow-up when the patient has decided against treatment in your office. So therefore, I always include in my third, fourth, and subsequent follow-ups, please let me know if you've decided against treatment or chosen a different provider at this time so that I do not continue to contact you if that's not what you desire. I want actually to let the patient know that I'm here to serve them, and I will follow up with them to be able to serve their orthodontic needs. And this allows for them to recognize and to let me know if in fact they've decided against treatment, chosen a different provider, or simply need to wait. Maybe they may be transferred. Maybe they might be losing their job or their insurance might be changing and they need to wait for that. That's fantastic because then we get to customize our follow-ups accordingly and follow up when that time is appropriate. When a patient decides against treatment with you, you should always attempt to gain information behind the reason for them not pursuing treatment. You should never make assumptions on what that reason is. This allows us to make adjustments where we might have the opportunity in our services or processes with a full, truthful understanding of what those barriers or choices were. So below is an example of the script for asking a patient the reason behind them choosing a different provider. Thank you so much, Mrs. Green, for letting me know. It's very important to us that we provide the best service and care to our patients. Would you mind letting us know the reason behind your decision? Your feedback is extremely valuable to us as we strive for a very patient-centered experience. So this is always a follow-up that I follow up with when a patient has decided against treatment. I find behind a screen when it's email, I get more responses, and I find I get about responses 30% of the time, which is more than not getting that information, and it's important that we have that information. So I'm actually going to pause here for a moment before we move on into the marketing pieces, because we did get a question and it says, how can we better approach patients and parents who come in because they are shopping around? Who have another appointment set up at another office days after ours? Great question. Thank you so much for asking that question. I actually love second opinions because I know that my pending follow-up process is more thorough than anybody else's out there. And here's a very powerful question or statement that you should include in every exam that you have. Doctors, don't be afraid to ask this question. Treatment coordinators, don't be afraid to ask this question. What are you looking for in an orthodontist? Michelle, it's so great to see you today. We're so happy to have you here. Tell me a little bit about yourself. Tell me what you're looking for in an orthodontist. Is it going to be price? Is it going to be a conservative treatment recommendation? Is it going to be an experience or a trusted relationship? When you get the answer to that question, you are armed with how to serve this patient. And when I talk about giving the best information the way they need it delivered, this is what I'm referencing and referring to. If a patient has to go with continued opinions, when they have to go to and get additional opinions, what they're doing is they're looking for additional information that we haven't provided them. Now, they may still go through and to confirm that we're their best option, but with an effective follow-up pending process, you better believe that you're the one that's contacting that patient efficiently. I always take note when that appointment is, and I follow up the next day. And I say, I realize that seeing another orthodontist can create additional questions. So what can I answer for you? What additional questions do you have? And I'm serving that patient. Somebody else asked if I recommend doctors following up or if I recommend the treatment coordinator. I actually recommend the treatment coordinator following up with the patient because as treatment coordinators, we are the ones that have spent a significant amount of time with this patient. We are the ones that are able to provide an opportunity with less barriers. And really, oftentimes patients or parents can feel intimidated with the doctor in giving the true barrier to what might be them starting treatment. So I recommend having the treatment coordinators follow up. It's a great idea to have doctors reach out to say, hey, Michelle, it was so great to meet you and your family. As always, let us know if there's additional information we can provide you. That's just a very high touch. So do you have an effective pending follow-up process that you utilize, and do you have enough time in the week to accomplish this task? Think about what is the most challenging barrier from patients for you to really overcome. Don't hesitate to reach out to me directly. Again, you're typing some great questions into the question box. I appreciate that, but this is about you, and I want to make sure that you get all of your questions answered. We talked earlier about using Propel to differentiate your practice or set your practice apart, and I wanted to touch on a few marketing ideas to do just that. Utilize this opportunity to target your patients past their completion dates. This can really be a jump start, or it can really jumpstart a patient that's burnt out and needs to get enthusiastic about finishing their treatment. Run those reports of your patients over your treatment time. You should always be running treatment efficiency reports on your D-band patients to understand if you are completing patients within their estimated months of treatment. And then target and use as a campaign, especially coming into springtime. Now, oftentimes we'll say brides and grooms, but I've done wedding shows before actually for high frequency vibration. And I've actually really liked to reach out to everybody walking by and say, is your smile ready for the big day? You might be a best man. You might be a bridesmaid. You might be a parent of the bride or groom. These pictures are forever. So every person that participates in a wedding has an opportunity to be able to get the smile that they've always wanted. So I like to leave that open to be able to say, is your smile ready for the big day? And provide the opportunity that you have that can at least get them a significant way through treatment through the high frequency vibration. Look at the parents of children in treatment. Chairside assistants should say, Mom, do you still wear your retainers? And then whatever mom's response might be, no, I lost them in college, or they told me to stop wearing them after 2 years, perfect dialogue for our chairside technicians to be able to say, Mom, have your teeth moved? Did you know that we could put your teeth in the same position they were in when you got your braces off, and we could do it using clear aligners and V-Pro in a fast and comfortable way? We have a great family care program, and we'll take great care of you when you're ready. Just let us know. Again, there's no high pressure sales about that. It's being passionate about our patients having their greatest smiles that they deserve. Offer your patients and your staff's incentive. Offer branded gift cards, announce patient winners to interest new patients, or provide staff recommendation contests. There's so many great opportunities that we have to really use for marketing to differentiate our practice. Don't ever provide a service or treatment modality that you keep hidden in a cabinet or offer sometimes. Get excited, shout it from the rooftops, put it all over your social media platforms. There is a reason you provide what you provide, and you should be enthusiastic and proud of this. Get that information out there with branding and testimonials. Every single person in your practice should be educated and scripted on what V-Pro is for your patients. Because if a patient or a parent picks up your device that you have for demonstration and they say, you know, oh, what, this is cool, what's this? I want that team member to launch into the benefits of what it provides our patients, and to launch into how our patients love it, and really create that enthusiasm. Don't simply pass it on to the treatment coordinator or hand them a simple brochure. Create that enthusiasm within your team members. And this is where you find a tremendous level of success within your practice in really extending this out to your patients and creating that reputation for yourself within the community as well, and what you stand for, what you provide in your experience for your patients. So remember, everyone stays on message to accelerate every start. This is the synergistic messaging and communication, utilizing every team member as educators and influencers in your practice. Meet your patient needs to have reduced visits, quicker treatment while still providing that same great finish while using high frequency vibration. Because this process leads to happier patients, which leads to more referrals in your practice. Use this as an opportunity to differentiate your practice. As I stated in the beginning of our time this evening, I wanted each of you to be able to take away 3 pearls to adjust or implement into your office tomorrow. I would actually love it if you got on my social media platforms or on my Facebook group, Ortho Masterminds, and talk about what those are or the success that you have with them, because I will be right there alongside you, cheering you on and celebrating your successes with providing the greatest orthodontic care and experience to your patients. I would love to hear from you, to hear about what you did and how it turned out for you, as well as any challenges or struggles or barriers that you have. I'm a resource to you. I know that your team at Propel is a fantastic resource for you as well. We have a few minutes for questions, and I know one is coming in. Question: how do you suggest convincing a patient coming in for adjustments that declined V-Pro in the initial planning that it is still a valuable tool for treatment? Actually, I don't like to use the word convince. What I want to do is I really want to share the value of what it is. And it's a great opportunity after the first or second adjustment to the patient, because now they've experienced what adjustments feel like, and they've experienced what that discomfort might be. This is where so many missed opportunities are in practices, because chairside technicians don't dialogue with the patient. They feel like the patient declined V-Pro in the exam, not having any experience of what an adjustment might feel like. But after the patient comes in for their first adjustment or their second adjustment, and now they know what treatment is feeling like, and they realize, 1, they would like to minimize that discomfort, and 2, let's speed this up as quick as possible. That's a perfect opportunity for a chairside technician to say, you know, I know Michelle talked about V-Pro with you in the exam. Did you have any questions, or did you want to revisit that after you've had a few of your adjustments? It really does minimize on any discomfort. and it allows us the opportunity for a faster treatment. So chairside technicians, this is when I talk about that synergistic communication throughout your whole practice. Your chairside technicians should fully be expected to have that dialogue with your patients, even if they've declined it at the exam. Again, it's not high pressure sales. It's simply asking the patient, would you like to hear more about that? Would you like to revisit that? And that's a great word. Would you like to revisit that after you've experienced a few appointments? Many of our patients really recognize that they do want to minimize any discomfort and they want to speed their treatment along. And you can just simply notate patient declined, and that's not a problem at all. Great questions. I really appreciate the interaction this evening. I just really want to thank all of you for joining me tonight, spending your evening with me. I feel honored to be here. And again, I really want to thank the team at Propel for this opportunity and for their continued commitment to your success. Please don't hesitate to reach out to me directly through my website, www.ortho-consulting.com, if you have any additional questions or if there really is anything that my team and I can do to support your tremendous success and take you to that next level. Thank you again. Have a great evening and good night.